Okay.
Greetings to Madam Raihan, and I'm Dinesh Varan, and we are from Group 2. So we're going to present our multicultural project too, and we've done the report, so here's the presentation. Next slide. All right, let me start up with the introduction for our report. So in the introduction, I've explained about the 4 main approaches in counseling, which is psychoanalytic, cognitive behavioral, existential humanistic, and the last one is multicultural and social justice. So in this report, we have focused on multicultural and social justice as the 4th force, which is acknowledged by Peterson in 1988. This is because this is important for inclusivity and the effectiveness of counseling. This is due to the evolving multiracial and multicultural society. This is not only in Malaysia, but all around the world. So moving on next to the Malaysia's social complexity, which is population diversity is 68.6% Bumiputera, 23.4% Chinese, and 7.0% Indian, and 1% is others. We can see the multiculturalism in this statistic. Economic prosperity lead to social, community, and family changes, which also increase in psychosocial stress. Therefore, the role of multicultural counseling in Malaysia fosters overall well-being, promotes health coexistence among diverse population. In this report, we have, even though multiculturalism is our main topic, but we have narrowed down our topic to women's mental health in Malaysia, and how we counselors can help women's mental health in Malaysia. So therefore, according to statistics, 54% of female respondents reported higher stress of anxiety. This is due to several factors, for example, like pregnancy, parenting, menopause, bad life events, and those are the factors. In conclusion, we have come up with we have searched and studied 2 different articles that we will be explaining in this presentation. So I will pass the presentation to the next person. Thank you.
All right, thank you, Dinesh, for the good introduction. So my name is Dania. So for the first article, we have choose the case study of cultural consideration in using cognitive behavioral therapy with Chinese people, a study of an elderly Chinese woman with generalized anxiety disorder. So here I will brief a little bit about the client background. So the client background in this article is named Mr. Young. She is 69 years old. He married 20 years to her New Zealand husband and lived there in New Zealand for 20 years. In this study, they both has no children. So the presenting problem is she was happily married to her husband until her husband diagnosed with diabetes. And then she was also been diagnosed with anxiety due to he need to take care of her husband. So she was referred for cognitive behavioral therapy, which is CBT, for depression and generalized anxiety symptom. Okay. The anxiety, as I said, the anxiety appear related to her husband long-term hospitalization, which left her feeling alone and struggling with her health and cognitive problem. So in this case study, it said that she has come from a close Chinese family and had happy early marriage, but her husband's illness took a toll on their relationship. So basically, Mr. Young need to struggle a lot to take care of husband, and in this case also, it settled some of financial issue because Mr. Young need to look for her husband. So next slide is next slide is strength and weaknesses. Okay, I will talk about the strength and weaknesses of the counselor in this study. So first is the counselor culturally sensitivity. So cultural sensitivity was one of their most notable strengths. They not only respected Mr. Young language preferences and physically limitation, but also made the effort to conduct therapy session in her home. Okay, this demonstrated a genuine understanding of the importance of creating a comfortable and familiar environment for the client. All right, so next is the counselor ability to collaborate effectively with an interdisciplinary team. This is also one of the strengths. Okay. By working alongside psychiatrists, which is the counselor working with the psychiatrists and social workers and the psychiatrist nurses, that ensure that Mrs. Young receive a holistic and well-rounded treatment plan. For me, this is a collaborative approach facilitated, which is a comprehensive understanding of Mrs. Young's condition and allow for the integration of both what we call psychopharmacology and psychotherapy. All right. So the last trend that I have found in this case study is also the thoroughness of the counselor assessment process was another commendable aspect of their work. All right. So in this study, by identifying specific aspect of Mr. Yang's personality and circumstances that align with the principle of cognitive therapy. Okay, the counselor ensured that the chosen therapeutic approach was well suited to their needs, to her needs. So this approach increase the likelihood of treatment success and help build a solid foundation for therapeutic progress. So next is the weaknesses of the counselor. So first that I found is the issue of therapeutic boundaries. Sekejap,
Okay, dah.
sabar-sabar. Aku punya ni hilang pula. Mana Zoom ni? Okay. Dah eh?
Dah.
Alright. Okay, continue with the weaknesses. Okay, despite the strength, there are also some weaknesses. Areas where the counselor could have improved their approach. So the issue of therapeutic boundaries emerge when conducting session in Mr. Young's home. So I think while this gesture was well intentioned, it might have compromised the establishment of clear professional boundaries. Mr. Young requests for help with household chores underscore the need for the counselor to clarify and maintain the appropriate boundaries. All right, furthermore, the next weaknesses that I found is the counselor failure to adequately address Mr. Young's concerns about the prescribed medication was a limitation. All right, a lack of communication and clarification regarding potential side effects and contraindication may have contributed to Mr. Young's sporadic use of the medication. A more proactive and transparent discussion about medication management could have improved Mr. Young's treatment adherence and overall progress. So the last weaknesses that I found also, the counselor ability did not meet the client expectation. All right, this is what I mean. This is when the client, Mrs. Young, expect of a magic solution and quick fix from the therapy. So the counselor could have worked more explicitly on managing this expectation and fostering a collaborative approach on therapy. All right, so the counselor need to do more work to meet the counselor expectation. So this is from me.
Okay, thank you Daniel for the strength and weakness of the case study. So I'll continue with the limitations of this first article. So the first one, as stated here, it shows that exceeding dependency and neediness of the client, which is Mrs. Young. It shows that Mrs. Young crossed the boundaries as the client, and also it interrupts the therapeutic and the professionalism of the study conducted. As for example, just like Dania mentioned before, that Mrs. Young, one of the clinical interview that conducted for Mrs. Young was conducted at her house, because she mentioned that she couldn't drive, but eventually it knows that she just can drive to any other social event. So this is one of the limitation of the article and case study to be conducted professionally. And the third one is less explore of the upbringing and environment. This, when I say this is because one of the data or one of the information mentioned in the case study shows that Mrs. Young is being pampered and being taken care of when she was young. So hence the reason why he has a high level of dependency and neediness towards her husband. But the validation and the confirmation of this information is not confirmed. So based on the limitation, this inaccurate information will lead and influence the verdict of this case study. And then the last one is only one case study is being studied on this matter, on this anxiety disorder. So the verdict and the result of the case statement cannot be generalized towards all elderly Chinese women, because only one subject and one case study being conducted. So these are all the limitation of the article 1. I'll pass to the next presenter.
All right, thank you. Thank you very much, Krishna. So I'll be continuing the presentation with implication. So from my observation and analysis, there is two implications that we can take. That's key takeaway from the case study. The first one is cultural integration in therapy, and the second one is cultural sensitivity and competence among the counselors. For the first one, integration of cultural consideration, which basically refers to the incorporation of cultural awareness, sensitivity, and understanding into the therapeutic process. The therapists or the counselors need to be aware of and respect the cultural norms, values, beliefs, and practices of their clients for a better outcome. The second one is cultural sensitivity and competence, whereby I believe that all counselors around the world should be sensitive enough and have knowledge about at least minimum of 40% knowledge around about culture and norms and beliefs. Therefore, cultural sensitivity and respect for clients' diversity are essential for counselors to be considered competent. This is actually extracted by a book from Wage 2015, and therefore, lack of awareness of biases can lead to assumptions or judgment that affect therapeutic process and outcomes. We can understand that a counselor who doesn't have cultural sensitivity are going to be biased, and there's going to be a lot of unnecessary assumption about the client. Therefore, it's very important for a counselor to have knowledge about culture and norms. Yeah. Thank you very much, and I'll be passing the presentation to the next presenter.
All right. Hi, my name is Emilia, and I will be presenting about the summary of article number 2 and also the counselor's approach. So first of all, the article number 2 is titled Counseling a Taiwanese Woman with Infertility Problems, and it was written by Yin Lin. So this article is about a client named Sue, who is 38 years old, and her family consists of her father, mother, 3 sisters, and 1 brother, as well as her husband. So her presenting problem is that she has grief and sadness over her inability to get pregnant, and she is also diagnosed with generalized anxiety disorder, major depressive disorder, and also adjustment disorder. Based according to the DSM-4, after she started counseling with the counselor. So, background about Sue is that she comes from a traditional family, and in her family is that her father treats her and her siblings harshly, and her father would frequently punish her every time she does something wrong. And after she has grown up, she is married to her husband, but their relationship is rocky because throughout their 7 years of marriage, they have a lot of arguments, and this caused her to feel hopeless towards their relationship, and she believed that having her child would be her lifesaver for her marriage for her whole life. So when she underwent counseling, she realized that she has a lot of grief, she has a lot of sadness, a lot of like negative emotions, and then the counseling session helped her to deal with those emotions, and also helped her to build up her confidence and to also be more than what she was at the time. So with this, she developed her career and she went to study. So this made her much more happier at the end of the session. Going to the next slide for the counselor's approach. Right, so there are three notable approaches that the counselor did inside the article, which were RCC, Relationship Centered Counseling, and then CBT, Cognitive Behavior Therapy, and also Gestalt. So for RCC is Okay, so RCC is a type of counseling approach where it is applying humanistic approach, whereby the counselor and the client relationship is used as a medium between these two. So the counselor would show empathy instead of being distant from the client. So in the usual case of counseling, the counselor would seem distant from the client and would not show as much facial expressions and as much care. But in RCC, the counselor needs to show empathy, needs to show a lot of care towards the client so that the client would be able to explore her pain, her grief, her loss, loneliness, sadness, and helplessness and desperation. Now for CBT, the counselor used CBT so that the client too could develop useful and positive behaviors. So some of the techniques in CBT that were used were reinforcement, assertive training, and also muscle relaxation. So reinforcement was used to reinforce positive behaviors so that it can happen more frequently. And then assertive training is to help her to build confidence so that she can stand up for herself and also to communicate her feelings to others like her family and also her husband. And then lastly, muscle relaxation is useful for a person that's diagnosed with GAD, which Sue is diagnosed with GAD. Now, lastly, Gestalt therapy. Some of the techniques used in the case study were empty chair, role play, and self talk. So the reason why Gestalt therapy was used is that it helps to intensify her emotions in the present, and it allows her to be aware of the unconscious emotional processes that she has. So, and also like techniques like empty chair and role play can help her to have closure on her unresolved feelings, and it lets her to say her piece when she was not able to in the past. So that is all from me. I will be passing to the next presenter.
Sempat.
On to the strength of the witness for the Article 2. So for the strength, consider innovative strategies to boost their confident and effectively. So I go for the example on the counselor. So counselor conduct the session with the Sue. So counselor use a type of technique to make sure the client realize one by one about her issue. So this skill counselor not only possesses excellent problem solving abilities but also exceed the thinking creatively and outside the box. So the next strength is counselor must aware and particular everything that client share. Counselor about us. Counselor aware that Sue has a lot of problem, like she had a symptom of depression, social stress, family issue, and Sue also mentioned that she had a problem with her husband, marriage relationship with the husband. So as a result, the counselor understand that Sue need a reason to the client why Sue comes to the counseling session. And the last strength is a counselor should accept every client background, belief, and value. So being accept and without being biased is an important role any kind of the counselor profession. For example, like client have experienced stress and trauma on this article, so the counselor assess the Sue uh, in being aware and her about her overwhelmed to this about their childhood trauma, which is this counselor aware that Sue feeling of impotence and lost her present life and her past of trauma. So moving on to the weakness, counselor have two weakness that I can see. First is the session are not consistently scheduled by the counselor. For example, the counselor just assess the client has a problem with depression and anxiety without specifically asking the client about her medical history in terms of her medicine. And the next is too many approach in the counseling session. Counselor take too much of time to manage the counseling session. For example, the obvious that I can see is counselor take too long for the counseling session, which is counselor finished the counseling session around 10 months. So moving on to the limitation of this article. First, a client try to cross the boundaries with a counselor. Why I can say that a client try to seek a great amount of love and care and unconditional positive regard from her counselor. Despite that, the client start to arrive the counseling session on time. And the next limitation is perspective. A Taiwan woman that infertility is a big problem. Clients suffering from anxiety and chronic depression caused by her infertility feel low or self-esteem, facing a negative emotion about herself, and this, as a result, counselor take time to manage and change the client behavior, especially relate the client family history, childhood experience, which is a past trauma about the client, and then define mechanism to achieve the client goal. Okay, thank you for next slide, which is an implication.
Izzah, ada orang nak masuk tak?
Ada Izzah dah admin dah.
Okay.
Hello.
Zuri, present.
Okay. So the implication of this article is about infertility women. So first I want to introduce about to reduce the perceived stress of infertile women. So the primary goal of infertility counselling is to teach each infertile couple and individual how to deal with the psychological and physical changes that will occur to them throughout the infertility, as well as many changes that may occur during of the course of therapy. So in addition, understanding of the underlying cause of the issue, as well as precise knowledge and of the emotion infertile people experience and the local culture in the area are essential for infertility consultants while working with infertile people. Also, we can increase about client social support network, strength and client interpersonal connection. Also, this case report objective is to describe about the client, how we want to reduce their physical problem, negative feelings, and also the how we want to increase their social support lah, especially. And lastly, I want to introduce about the individual counselling for those who are infertile often takes one or five forms. There is psychodynamic, psychotherapy, also cognitive behavioral that can help we to approach the client who has infertility problems. So counselor also apply free association and transference strategy from psychodynamic therapy. As a result, in this case, our client named Sue acknowledged that she learned and developed competence and confidence after 10 months of counseling session, especially when her academic achievement was at top of the class. So the client appeared to be a lot healthier, more healthier, and appeared fat, more youthful. So I think that's all from me.
All right, thank you very much, everyone. We have reached the end of the presentation. So therefore, I'm going to conclude everything that has been said. And the Council's commitment to learning and integrating clients' cultural background highlighted the need for cultural sensitivity in effective counseling in both circumstances, in both the issues or the case study that we have studied. This case study significantly highlight the tremendous effect of cultural influences on mental health experiences from the perspective of both the clients, as well as the need for therapists remaining aware of their own prejudices, bias, assumption, and their value and their belief. So we can understand that it's very important for a counselor to have multiculturalism competencies in order for a successful counseling session. Finally, these two case studies provide instructive instances of the dynamic and nuanced character of counseling treatments. This focus the value of personalized methods, cultural knowledge, and continual professional development for the counselors, for a betterment for the counselor and also the client. Therefore, that's all from us, and thank you very much, Madam Raihan.
Thank you, Danya. So now I will be presenting my part, which is the counselor's approach on handling the clients from the first article. So to start off, the approach used by the counselor for this case study was CBT, as the client needed cognitive restructuring due to her depression, generalized anxiety, and negative thinking patterns. Besides that, the counselor used the five-part cognitive model by Podolsky and Mooney 1990, which illustrates how thoughts, emotions, behaviors, physical sensations, and external factors influence a person's sense of understanding and response towards their surrounding. So there are two goals for the therapy. The first goal of the therapy was to ease Mrs. Young's depression and anxiety symptoms, while the second goal is to introduce her to the five-part model, which would assist her in understanding and picturing the root causes of her challenges. Moving on, Mrs. Young was given guidance in relaxation technique to effectively deal with her current state of anxiety, while guided discovery and role plays were used to address reliance problems faced by Mrs. Young. Moreover, role reversal techniques were employed to address her relationship issues with her spouse. And finally, deep breathing exercise were used as a relaxing strategy to reduce Mrs. Young's anxiety and panic responses. Also, along with the deep breathing exercise, a refocusing method was also addressed when, on a particular occasion, Mrs. Young's frustration escalated quickly. So that will be it from me. I'll pass it to the next presenter now.